Acute stretching or rupture of Chordae tendinae yields contradictory cardiac information. In this right side long axis view, the right and left atria appear to be of normal size and the atrial septum is flat. However, with color flow, the mitral regurgitant jet completely fills the left atrium, suggesting a severe mitral regurgitation. Prolapse of both mitral leaflets was apparent in this case, but flail leaflets were not seen. This 6.5-year-old 5-pound Papillon was presented with symptoms of respiratory distress and coughing. A 4 of 6 left-sided murmur was heard. Radiographs showed diffuse pulmonary edema, but heart size appeared normal. Symptoms improved with furosemide, but the heart rate remained at 197 beats per minute. The left ventricular fractional shortening was excessive at 55%, suggesting severe mitral insufficiency. The patient's measured systolic blood pressure was 120 millimeters of mercury. However, pressure gradient of the mitral insufficiency measured 150 millimeters of mercury, exceeding measured systolic pressure and indicating severe mitral insufficiency. Multiple parameters indicate severe mitral insufficiency, but the left atrium was not enlarged. With acute stretching or rupture of Chordae, the mitral insufficiency is severe, but the left atrium has not had time to enlarge. Dogs with acute stretching or rupture of Chordae tendinae are usually presented in respiratory distress and often die within 30 to 60 minutes in spite of all attempts to treat, especially if flail leaflets are seen. Any dog presented with a sustained heart rate of 140 beats per minute or higher should be handled with extreme caution. Radiographs and ECG should be avoided or delayed. The patient may die while being restrained for radiographs, ECG, or ultrasound. An ultrasound can be cautiously done in a standing or sternal position with minimal restraint while flow-by oxygen is given. First, do a right-side long-axis color flow of the left atrium, looking for size of the mitral jet and flail mitral leaflets. Because of the acute stretching or rupture of Chordae, the left atrium has not had time to enlarge as expected with a severe mitral insufficiency. Proceed with any other views and measurements you can get in a standing or sternal position without unduly stressing the patient. Treat as an advanced severe mitral insufficiency. Prognosis is grave, and most cases do not survive more than 1 to 24 hours in spite of your best efforts.